Hello and welcome. Today, we're diving into a complex eye condition called lens neovascularization. It's a mouthful, I know, but understanding it is crucial for preserving vision. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. So, let's get started. Lens neovascularization, or LNV, isn't a standalone disease. It's usually a consequence of other underlying conditions affecting the eye. The most common culprits are chronic inflammation, particularly uveitis, inflammation inside the eye, and conditions causing retinal ischemia, a lack of blood flow to the retina. This could be due to diabetic retinopathy, retinal vein occlusion, or even chronic retinal detachment. These conditions trigger the release of growth factors, signaling the body to create new blood vessels, even where they shouldn't be, like on the lens. Now, let's talk about how this actually happens. The lens of the eye is normally avascular, meaning it doesn't have any blood vessels. It relies on nutrients from the surrounding aqueous humor. When inflammation or ischemia occurs, it creates an imbalance in the eye's chemical environment. This prompts the release of vascular endothelial growth factor, or VEGF, and other pro-angiogenic factors. These growth factors essentially tell the body we need more blood vessels here. They stimulate the formation of new, abnormal blood vessels that start growing from the iris and ciliary body towards, and ultimately onto, the lens surface. These new vessels are often fragile and leaky, leading to further complications. Pinpointing the exact prevalence of lens neovascularization is tricky because it's secondary to other conditions. However, we know it's more common in individuals with poorly controlled diabetes, those who have had prolonged or severe uveitis, or those suffering from ischemic retinal diseases like retinal vein occlusion. The prevalence increases with the severity and duration of these underlying conditions. In populations with high rates of diabetes or limited access to eye care, LNV is likely to be more prevalent. The signs and symptoms of lens neovascularization can vary depending on the severity and underlying cause. Initially, it might be asymptomatic, meaning you won't notice anything. As the vessels grow, however, they can cause blurred vision, glare, and decreased visual acuity. The leaky vessels can also lead to inflammation and even bleeding inside the eye. In severe cases, it can contribute to the development of secondary glaucoma, a dangerous condition that can cause irreversible vision loss. Diagnosis of lens neovascularization typically involves a comprehensive eye exam. Your ophthalmologist will use a slit-lamp biomicroscope to carefully examine the lens and surrounding structures, looking for the telltale signs of new blood vessel formation. Fluorescein angiography, where a dye is injected into your bloodstream and photographs of the retina are taken, can help to visualize the new vessels and identify any leakage. In some cases, ultrasound biomicroscopy may be used to get a clearer image of the lens and ciliary body, especially when the view is obscured by inflammation. While there aren't official types of lens neovascularization, it's often classified based on its severity: mild, moderate, or severe depending on the extent of vessel growth and associated complications. It can also be classified by the primary underlying cause, for example, LNV secondary to diabetic retinopathy or NV secondary to uveitis. The treatment of lens neovascularization focuses on addressing the underlying cause and preventing further vessel growth. Anti-VEGF injections, which directly target the growth factors that stimulate vessel formation, are a cornerstone of treatment. These injections can help to shrink the existing vessels and prevent new ones from forming. In cases of uveitis, corticosteroids may be used to reduce inflammation. Laser photocoagulation can sometimes be used to seal off leaking vessels, and in severe cases, surgery, such as vitrectomy or even lens extraction, may be necessary to manage complications like bleeding or glaucoma. Preventing lens neovascularization primarily involves effectively managing the underlying conditions that cause it. For individuals with diabetes, strict blood sugar control is essential. Regular eye exams are crucial for early detection and treatment of diabetic retinopathy, uveitis, and other risk factors. Prompt and appropriate treatment of uveitis can also help to prevent the development of LNV. The prognosis for lens neovascularization depends on the severity of the condition, the underlying cause, and how effectively it's treated. Early diagnosis and treatment can often stabilize vision and prevent further complications. However, if left untreated, LNV can lead to significant vision loss, including blindness. Recent research is exploring new anti-VEGF agents and delivery methods to improve treatment outcomes and reduce the frequency of injections. Researchers are also investigating novel therapeutic targets beyond VEGF to further inhibit angiogenesis and prevent the recurrence of LNV. Thank you for watching, and remember, regular eye exams are your best defense against vision-threatening conditions.